happened?
Got short of breath during the night.
Why didn't you come in, for heaven's sake?
Thought I could wait for my dialysis.
I think we're going to have to dialyse you straight away, David.
I'm in pulmonary edema again, aren't I?
You have congestive cardiac failure due to fluid overload. Shortness of breath is due to pulmonary edema, possibly an intercurrent pneumonia. Your kidneys will be as grotty as ever. My guess is urea 30, creatinine 1100.
Urea 25, creatinine 1000.
It's a bet. Assume the position. I'll be back. Thanks. No joy. Let's try flushing with saline.
It's blocked, isn't it?
Yeah, it's either a clot or a stenosis. No, we can't use the other side.
That blocked 6 months ago.
We go for the femoral vein. A.
Ruby Taylor, date of birth 14/12/17, patient number G67451. Query small bowel obstruction.
Can you go straight round to Kirsty and help with the tendon repair, please?
Yes. Thanks, Kirsty.
Can you pass an NG tube and we'll get her to the ward? No probs. I'll book her for theatre.
It's done.
Oh, cheers, mate. You couldn't lend me a tenner for today, could you?
It'd be a great help if you could see the next one before you go.
Sure.
Thanks. I love you, Julie. Julie, I really love you, James. I really love Julie.
David's renal failure was caused by IgA glomerulonephritis when he was 8. He now has hemodialysis 3 times a week.
Are you waiting for transplant?
Kidneys are like the buses.
Better off mixing it with some steak and putting it in a pie than wasting it on a tosser like him.
He wanted to get into my underpants slapper. Only had to say so.
Right, you find the femoral pulse and work out the relations from there. Nerve, artery, vein.
Maybe nerve, artery, vein, Y fronts. Sodium 130, potassium 5.6, bicarb 23, urea 28.3, creatinine 1175.
Damn.
I do get bored being right all the time. Right, okay, let's get this going and start dialysis so that we can get those numbers down.
Oh, Kirsty, I didn't realise you were in here.
Can I help?
Yeah, please.
Can I have some Diamorph and some Maximum? Okay, but you'll have to draw it up, Doctor.
What really proper nurses about?
Right.
We'll be fine, thanks, Kirsty. Can we have a 12-litre, please?
Yeah, no problem at all.
We'll give you something for the pain immediately, sir. Where is it? In the middle of your chest? Does it go anywhere else? Your arm, neck, jaw, teeth, back?
Back.
Ever had this pain before? Thanks. Can you see if any of the medical team are about, please? These should make you feel more comfortable.
Rate 110, rhythm...
Sinus tachy, no signs of ischemia or infarction. Your heart tracing is normal, sir, but it still doesn't rule out some kind of heart attack. Chest pain unresponsive to opiates, normal ECG.
What's your differential diagnosis? Try aortic dissection for starters. AI murmur, no rub. Organise urgent CT thorax, measure blood pressure in both arms. Let's start a labetalol infusion.
Isn't blood pressure a nurse's job?
I suspect the cause of your pain is a tear in the big artery coming out of your heart. We're going to lower your blood pressure and scan your chest. You may require surgery. If the aorta continues to tear, you may die of it. Any questions, queries, comments, or worries? My kind of patient. We're just CTing him now, but I expect he'll be needing urgent cardiothoracic assessment.
I think you should look at this first.
That's a false alarm. Yeah, sorry. This isn't your heart. You have a fractured vertebrae in your upper back.
Is that serious?
No. Turf to orthopedics. Liz. When I ask you to do a blood pressure, you do it, okay?
Not smarting because of your misdiagnosis by any chance?
I'm sorry, Harry, but the doctor's not here yet. As soon as she arrives, I'll ask her about your test results.
Thank you, sister.
Right?
Sorry.
Liz, did you forget that Andrew's not here today?
Oh, yeah, sorry. I was really busy down in casualty.
Of course you were. Bloods. Phlebotomist couldn't do the INR on Mrs. Core and the U&E on Harry Gates. Venflons, that's Harry again, plus the chat with the CVA. These need writing up for analgesia. There's a couple of rewrites and a review antibiotics. Oh, and Harry's really anxious to know if they've got his pleural cytology yet.
Never rains but it pours, eh?
Rob, you could be a real sweetie and phone for some results for me, could you?
Well, I'm not really used to taking test results.
OK.
But I suppose I could.
You're a lifesaver.
Everything all right, Kirsty?
Yes, thanks, Julie.
Actually, has Mr. Smedley mentioned anything about Mr. Tennant? No. Why?
Microscopic appearance of oat cells. Thank you. Oh, Liz, I've got that report on Mr. Gates. It
Did
says,
they find any malignant cells?
Malignant cells? No.
Dr. Reed, yeah, you're bleeping me.
So the chief says to this bloke, death or umbongo? And the bloke chooses umbongo, so they tie him to this tree in the blazing heat, and all the warriors in the village take it in turns to shaft him up the dirt box. So then the chief says to the second shipwrecked bloke, shipwrecked. He says, death or umbongo? And the bloke chooses death. And the villagers, they all cheer and they chant, death by umbongo, death by umbongo! So, Raj, why don't you ask Julie to put in a word for you with Kirsty?
That Kirsty, right, she's just too good for me.
Get away.
No, mate, I'm just a loser.
Sounds like the Oedipus effect in action.
What's that?
Boring, that's what it is. Do you want a game of pool?
Yeah.
A prediction may actually increase the likelihood of an event that it was actually meant to avert. Or the fact that Oedipus was warned by the oracle actually made the tragedy happen. Let's just say that a man predicts that a woman won't fall for him. The word gets back to her, then she might be attracted to his modesty.
Is that a normal feature of your social life?
They're just having a laugh.
When you said come for a drink, I didn't realise you meant with your mates. I suppose you've told them that Paul Tennant is trying to accuse you of negligence? I'll just get another drink while you squirm.
Just cut it out with you. Just put on a bit better of show for Julie, please.
So where's the tenner that you owe me?
We just thought you wanted to be alone with her, that's all.
Yeah, well, anyway, we're not the ones who brought our girlfriend down. Hey, what's this? Not another chick. Don't you ever rest?
Hello, boys.
Hello, Mr. DeRees.
Hello, Mr. DeRees.
Mr. DeVries.
There's no wonder they're standoffish with you. There's not one of them you haven't been gitty with.
I thought you said you were going to give up smoking.
I put worse in my mouth.
I have a meeting.
Of?
The consultants committee.
Whole evening of screwing junior doctors.
Have you thought any more about my moving in with you?
In with me or on top of me, Adrian.
I have a son.